This is Dr. Torrey with RookieDoctor.com. It's time for another one of those quick tips. This time we're going to go over something that has to do with when you take action. And when you, let's say, are on call or taking care of someone in the hospital, or you do an action, basically. You should follow up on it. Any intervention that you do, you should follow up on it, especially in people that you are concerned about. So say, for example, you're called to the floor, somebody has shortness of breath, and you happen to think they're in failure, and so you give an extra dose of Lasix after having looked at their BUN and creatinine and all these things. Maybe you're on the fence about their BUN and creatinine, maybe you're not sure if it's failure or not, but your gut and your physical exam and the data is all pointing to failure, right? So you give the Lasix. Well, a few hours later, you should check back, and even if it's a one-line note that you say that patient seen and examined, shortness of breath has decreased, oxygen requirement has decreased, blah 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 blah, right? A quick one-liner, because there are several reasons to do this. One is to make sure that that your intervention was appropriate, and then also to make sure that it was adequate. Perhaps you come by and you see that the shortness of breath is better, but it's not quite as good as it should be. Maybe you need to give more. Maybe you need to do more. Maybe or maybe you were wrong. Maybe that intervention wasn't correct, and you need to change course. So those are two big reasons to follow up. Another reason is that when things occur, let's say something, God forbid, a bad outcome occurs, and this thing ends up in a lawsuit. Well, if you have one contact with this patient at, say, 11 p.m., and then the next one isn't till 4 a.m., but you did something and you were clearly concerned because you took action at 11 p.m., right? And then there's nothing for 5 hours. Well, even if you stopped by and did something, if you didn't write it down, basically it didn't happen. So you need to put that one blurb on there. That one sentence blurb: patient seen and examined, exam improving, vital signs improving, etc., etc. Okay, so follow up on any intervention you do. Same thing, like you put in a central line, you need to check the chest x-ray, make sure there's no pneumo, etc. You change someone's pain medicine around, someone needs to document that the pain is well controlled, after that intervention. So even if it's just a phone call back to the nurse, it's okay to ask the nurse to document in their progress notes that the patient's pain is better controlled, if that's what they found. So follow up on any intervention that you do, and it will serve you very well on levels that you may not even be thinking of yet. So make sure you do that. Now, another tip, if you haven't seen it, is at internship-tips.com. Go ahead and check that out. That's my #1 tip for your medical and surgical training for med students, interns, and residents. Internship-tips.com.